is concerned. Once again, you're most welcome. Now, looking at the backbone of it is that numerous Ugandans are facing hardships. You and I are facing these hardships in accessing healthcare because of the high out-of-pocket costs that cannot be afforded by the general Ugandan. Currently, you do have 38% of the healthcare expenditures being paid by individual Ugandans. You do have 41% by development partners, and the government contributes about only 16%. Now, the National Health Insurance Scheme is an essential tool for addressing this problem of high out-of-pocket expenditures, but this requires the National Health Insurance Scheme bill to be supported by government and endorsed by the head of state. To expound more on what would be the benefits should that endorsement happen to all Ugandans, we do have Mr. Ainebyoona Emmanuel, the Health Ministry Spokesperson, joining us. Good morning to you, sir.
Good morning.
Okay.
Good morning, viewers.
Then we also do have the Executive Director of Self for Health, Frederick Makaire. Thank you so much for being with us. Good morning.
Good morning, and good morning to the viewers.
Okay. Now, starting with you, Frederick, I need to better have my audience understand the National Health Insurance Scheme. What is it?
Thank you so much for having us on the show. The National Health Insurance Scheme, in simple terms, I can say is a mandatory contributory scheme. Mandatory and contributory established by law. So meaning that there must be a law establishing a scheme which mandates all of us as citizens to belong to it, and we have to make a contribution to that scheme. Some of the benefits of such a scheme to a country like ours, it will make sure that it protects our citizens from incurring catastrophic expenditures. You know, many times we fall sick and we are not prepared for these costs. And so the scheme protects the population against such high costs, but also unprepared for costs. So that is one of the key benefits of such a scheme. It simplifies access to healthcare because when it is in place, it doesn't require anybody to have cash before they go to use the services. So it makes it easy for the population to access. It makes it simple for people to access services, and not any service, but those of quality. It also reduces the cost of healthcare on each individual, because this scheme is a risk-sharing scheme, also cost-sharing. When we contribute some money to that scheme and it is pooled, it means that when I am faced with a bill of, say, 500,000, I'm not going to pay it alone. The entire population, all the members who are part of the scheme are going to support me in meeting that bill. So it becomes cheaper for me, but also for everybody who has contributed towards this bill. It also helps with raising more revenue for the health system, because healthcare providers, when they treat and build the insurance scheme, they are assured of 100% cost recovery. Unlike in the current scenario when you don't have any insurance cover, you may go, and we saw this during COVID, the experience of COVID. People were admitted, they were billed 20 million and they couldn't pay. So in the end, the health facilities either lost the money or they tried to detain patients, dead bodies, but some of them lost the money. So if we had this national insurance scheme, none of us would have gone through that experience. We would easily afford, and we would easily clear those bills, and the service providers would also recover all the money that they would have incurred in treating our patients. But finally, it is something that will also improve workers' productivity. You know, when we are accessing healthcare services easily in time, it means that we are able to be healthy, and then we are providing more time for our work, and as a population we become more productive. So this is what we are talking about as a national. And
what's the proposed mandatory contribution of the Ugandan should it take center stage?
Well, I'm sure Mr. Ainebyoona will be the best person to give this because he's speaking for the ministry. But of course, we have been hearing the minister recently here and in other forums talking about the 15,000 shillings. But I think now that the spokesperson is here, I think he should be the one to...
Mr. Ainebyoona, on the hotspot you are, more details into the health insurance scheme, the mandatory contribution of the Ugandan out there, if this was to actually be taken into consideration.
Since, the bill is still a subject of discussion, and I'm glad to indicate that it has now been resubmitted to Cabinet for further discussion. The amount that has been suggested is a flat rate of 15,000, but as I said, there are very many...
And that's on an annual basis?
Mechanisms, yeah. But we think that if every Ugandan could contribute that, then we pull it together, because we shall not all fall sick at the same time. So that one will, like the way NSSF works, we will be able to pull resources, then cater for those who fall sick within a health care package, because there are some diseases that we might not be able to cover, like dialysis, and also some non-communicable diseases like cancers. So there will be a specific agreed health care package, which a patient, when you go to a health facility that is accredited, will be able to get these services and treatment. So for now, subject to discussion is that 15,000 the Minister of Health has indicated.
All right, Mr. Makaire here has given us the perspective that would be beneficiary to the Ugandans. On the side of the health sector,
yes,
how does this bill actually aid and improve health services across the board?
Yes, of course, we still have too much dependence on external financing. As he indicated, a big chunk of the health expenditure, when you look at the national health accounts, is from health partners. Then you look at what government is putting on. So the National Health Insurance Scheme will bring in more revenue. Because there will be a body responsible to ensure that these resources are collected, there is regular payment of this premium, and also the health providers are provided with their funds. So it will help us to save Ugandans from the catastrophic out-of-pocket expenditure. It will also bring about competition. And competition, you know, competition brings about improvement in the services you get. So we expect to have improved healthcare services across all the accredited facilities that will be providing services. But also it will help in regulation, because right now it is only private or commercial health insurance that is running, and also the other community-based health insurance schemes. But now this would be under the regulation of the National Health Insurance Scheme, the body, and also the Insurance Regulatory Agency.
Okay.
Yes.
Today would have been a conversation about implementation. However, that is not the case, because when it was presented to Cabinet in 2021, it was pushed back for some rectifications here and there. What are some of those positions that the ministry has then been working on to then bring it back to Cabinet?
Largely, there was a discussion on how it will work, which approach we shall take. Shall we have a merged scheme that is compulsory? Shall we have coexistence of the community-based, the private, and all those have been catered on. It was sent back largely that there was need for much consultation of the key players, the Uganda Manufacturers Association, the National Organization of Trade Unions, CASITA. So the president thought it wise that there was required more discussions and consultations about this bill, and since then these consultations have happened, and as I indicated, it has been resubmitted to cabinet for discussion. So we are hoping that it will get more support at the cabinet level, and when it is tabled before Parliament, it will be passed and ascended to by the president without any hesitations. That is our hope as the Ministry of Health, because it's among our priorities in the National Development Plan.
All right, thank you so much, Mr. Ainebyoona. Mr. Makaire, he has talked about community-based health insurance schemes. Could you give us more enlightenment on that? Because they kind of benchmark on what we would be expecting on the national level. So with that benchmarking, how have they actually been productive in making sure that people actually can afford good health and also can afford good treatment?
Thank you. So the community-based insurance schemes have existed in the country. By the way, they were started by the Ministry of Health in 1996. So they started it as a pilot, and then many organizations, including many NGOs, picked that up and started implementing them. These, unlike the National Insurance Scheme, these are private schemes. The enrollment or membership there is voluntary. It's not mandatory like the NHIS is proposed. And so they are mainly currently targeting the low-income earners, mainly in the informal sector. So they have been running since that time for now about 25 years. And they have actually helped mobilize people in these communities that would actually be, who are excluded from accessing services and who face mostly these challenges of financial barriers to accessing healthcare services. So they bring them together with their small contributions. That money is pulled together into one fund, and then it is spread. Their risks are spread among the members. So what it does, and where it has really helped the community, is that everybody contributes something like 20,000 shillings per head per year. And that is really something that we think is affordable. Then this money is put together in a pool, and then they start using that money to access services. So whoever among the members, whoever falls sick, when they go to the hospital, instead of the hospital billing the patient, it instead bills the community insurance scheme. So that has relieved the families the burden of paying these bills. Instead now they work together as a group and clear these bills. So this is how the community insurance schemes have been very useful. And that is the lesson or the support it will give to the national insurance scheme when it comes, because it is reaching the very poor and maybe hard to reach communities in the rural areas, in the informal sector. People who are earning not a regular income, but probably seasonal incomes, whose incomes are not really high, but whose needs in terms of accessing healthcare are actually immense, high. So it helps these people to actually mobilize the little resources, come together, put this money in one pool, and then access these services. And this is what the National Insurance Scheme actually is also trying to do. Yeah.
Okay. All right. Bring it to the larger scale. All right. As we wrap up this conversation, Mr. Ainebyoona, I know that there was the 7th conference that was held in Entebbe 2 weeks ago regarding to health on a national level, and I know that, of course, the scheme was one of the discussions on the agenda. But what other commitments came out of that conference regarding improving the health sector overall for Uganda?
Of course, key among them is to see how we can improve on the financing, which the National Health Insurance Scheme is one of them, but also for the meantime, the Ministry of Health is largely focusing on ensuring that we improve on disease prevention, and also ensuring that we do much of preventing the disease, because health is made at home and only repaired in health facilities. So we want to put more emphasis to ensure that people do not come to the facilities by improving their hygiene, sanitation, but also the discussion, we are looking on a roadmap how to facilitate this discussion when it comes to Parliament, and also to prepare grounds finally when the bill is enacted. So we shall continue with sensitizing Ugandans about the importance of having a national health insurance scheme, understanding why, if finally assented to, they need to regularly pay premiums, and also understanding the composition of like the National Health Insurance Scheme Board and their responsibilities.
All right, thank you so much, Mr. Ainebyoona, spokesperson for the Health Ministry here in Uganda, and Mr. Frederick Makaire, Serve for Health. And that definitely puts into perspective the many strides that are being made towards universal health coverage before 2030, which is under Sustainable Development Goal 3. And if this definitely passes, then we shall be right on track for that. That brings us to the end of this conversation. More coming your way. Don't move a muscle.